Assalamu alaikum and hi. In today's video, we are going to discuss about tachyphylaxis and tolerance, one of the most confusing topic in pharmacology. So let's start the video. Definition. Let's see the definition of tachyphylaxis and tolerance. What is tachyphylaxis? Tachyphylaxis refers to a rapid decrease in response to a drug or treatment following repeated administration over a short period. It often occurs within a minute to hours of initial exposure. A rapid decrease in response to a drug is tachyphylaxis. Tolerance. Tolerance, on the other hand, is a gradual decrease in response to a drug. It is a gradual decrease in response to a drug or treatment following repeated administration over an extended period. It typically develops over days to weeks, so you can clearly differentiate the rate of development and the rate of decreasing response. Here, the rapid decrease occur while in the tolerance, the decrease in response is gradual. Same is the case with development of tachyphylaxis. It develop over a short period of time while tolerance take longer to develop. It typically takes minutes to hour while tolerance take days to weeks. Time frame. Tachyphylaxis. Tachyphylaxis occur rapidly, often within the course of a single administration or within a few administrations or short period. Tolerance. Tolerance develops gradually over a longer period of repeated exposures. Yearly repeated exposures are important. Mechanism. Tachyphylaxis often involves repeat desensitization of receptor or adaptive changes in cellular signaling pathway. It can also involve pharmacokinetic factors such as rapid metabolism or distribution. Tolerance. Tolerance may involve similar mechanism but occur over a longer period, allowing for more complex adaptations such as change in receptor densities or sensitivity. Here, receptor density may also be affected. Alteration in gene expression or neural adaptation. Here, neural adaptation, gene expression, genetic factors may also be considered in the case of tolerance. Reversibility. Tachyphylaxis can be reversible. Very important to remember, with the diminished response quickly returning to a baseline once the stimulus is removed. This suggests that tachyphylaxis may involve more transient change in cellular signaling or receptor function. Very important, tachyphylaxis is reversible. Tolerance Tolerance may or may not be reversible depending on the underlying mechanism involved. Some form of tolerance may persist even after the cessation of stimulus, requiring extended period of withdrawal or for reversal. So it takes longer period to be reversed. Clinical implications. Tachyphylaxis can pose challenges in acute treatment scenarios where repeated dosing is necessary. Tachyphylaxis is important in acute treatments, such as in the management of acute pain or in emergency medicines. Here, in examination, you can be asked about different scenarios in which acute case will be dealt. So you have to remember tachyphylaxis in the case of acute pain. Clinician may need to adjust dosing regimes or switch to alternative therapies to overcome tachyphylaxis. Very important method to cope out tachyphylaxis is to change the regime of drug or to switch to alternative therapies. Tolerance is more commonly encountered in chronic therapy scenarios such as in the management of chronic pain, psychotic disorders, or substance abuse. Clinician may need to increase drug dose. Here, switching is not important. Changing of dose is important. So, in the case of tolerance, we usually increase dose, while in the case of tachyphylaxis, we change or switch the dose or drug class. Alternative treatment to maintain therapeutic efficacy. So, this is tolerance. Summary. In summary, while both tachyphylaxis and tolerance involve a decrease in the response to a stimulus over a time, they differ in terms of their rapidity of onset. Which one is rapid? You can clearly say now. Underlying mechanism, reversibility, which one is reversible and which one is irreversible, and clinical implications, which I already discussed in the slides. Tachyphylaxis occur rapidly and may be reversible, often involving transient change in receptor function or cellular signaling. In contrast, tolerance develops gradually over time and may persist even after the stimulus is removed, involving more complex adaptation at the cellular and neural levels. So this is all about tachyphylaxis and tolerance. Thank you so much for watching. If you like this video and you want to appreciate my efforts, so please subscribe this channel and like this video. Thank you so much for watching.